We are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Hello, welcome to the Papers podcast series for the Association for Child and Adolescent Mental Health, or ACAMH for short. I'm Jo Carlo, a freelance journalist with a specialism in psychology. In this series, we speak to authors of papers published in one of ACAMH's 3 journals. These are the Journal of Child Psychology and Psychiatry, commonly known as JCPP, the Child and Adolescent Mental Health, known as CAMH, and JCPP Advances. Today I'm interviewing Dr. Sichun Chan, a postdoctoral fellow at the Department of Psychiatry at the Chinese University of Hong Kong. Sichun is the first author of the paper Subtyping At-Risk Adolescents for Predicting Response Towards Insomnia Prevention Programme, published in the JCPP. This paper will be the focus of today's podcast. If you're a fan of our Papers podcast series, please subscribe on your preferred streaming platform, let us know how we did with a rating or review, and do share with friends and colleagues. Sichun, thanks for joining me. Can you start with an introduction about who you are and what you do?
Hi, Joe. Thank you for your kind introduction. It is my pleasure to join you today. I'm Sijin Chen. Currently, I work at the Department of Psychiatry at the Chinese University of Hong Kong and the School of Psychology at the Laval University as a postdoctoral researcher. My research interest lies in exploring the associations of sleep disturbances with psychiatric disorders, neurodegenerative diseases, and physical disorders by using meta-analytic methods, conducting randomized control trials, and analyzing longitudinal data.
Great, thank you very much. So today we're going to look at your paper about insomnia prevention. To help set the scene for us, can you tell us a bit about insomnia in adolescents? So what is the prevalence and what is its impact?
Sure. Insomnia is the most prevalent sleep disorder in adolescents. According to our previous study, insomnia affects more than 10% of the adolescent population with a surge in late adolescence. In addition, adolescent insomnia has significant adverse impacts on future health and functioning, and it has been found to precipitate and maintain various emotional and behavioral problems. For example, our previous research showed that insomnia during adolescence has a high chronicity, which is associated with an increased risk of developing depression and suicidal ideation.
Thank you, Sichun. Let's turn now to the paper itself. So this is Subtyping At-Risk Adolescents for Predicting Response Towards Insomnia Prevention Programme, published in the JCPP. Can you give us a brief overview of the paper? What did you look at and why?
Yes, sure. First, to provide some background here, I would like to talk a bit about our previous study. In our previous study, we discovered that a 4-week cognitive behavioral prevention program was able to reduce the risk of developing insomnia among adolescents with a family history of insomnia and the subthreshold insomnia symptoms by 71%. The current study is a secondary analysis of our original studies, where our aim was to further evaluate who would benefit from the insomnia prevention program with the most meaningful improvement. The main rationale for conducting this study lies in the increasing recognition of insomnia as a heterogeneous disease. Despite this recognition, the potential subgroup differences in response to sleep intervention remains largely unknown, especially among the adolescent population. We believe that by evaluating subgroup differences in response to the insomnia prevention programs among at-risk adolescents, we can enhance our understanding about the effect of the prevention program on elevating sleep and mood symptoms, as well as the specific needs of different individuals. The findings are expected to enable us to refine current intervention strategies and develop personalized insomnia prevention in the future study.
Great, thank you. That's really helpful. Can you also tell us a little about the methodology used for this study?
Yeah, in these studies, we use a model-based clustering technique called latent class analysis to identify subgroups of at-risk adolescents based on their baseline characteristics, including sleep, daytime, and mood profiles. By using latent class analysis, we were able to uncover the intersections of these characteristics and identified unobserved subgroups, so-called latent classes.
Thank you. So the paper refers to the use of a brief cognitive behavioural insomnia prevention programme. Can you briefly describe what the prevention programme looks like? So how does it work?
Sure. Our prevention program was adapted and modified according to the key components of cognitive behavioral therapy for insomnia, with the particular emphasis on the precipitating and perpetuating factors that can lead to the onset of insomnia. In particular, behavioral and cognitive strategies, including stimulus control, sleep hygiene, constructive worry technique, and relaxation were introduced with the aim to foster good sleep habits and avoid negative behaviors or cognitions that might trigger insomnia. The intervention was conducted in group format with 6 to 8 participants per group.
Great, thank you. Can I just ask what ages of the participants were?
Their adolescence is about 12 to 18.
Okay, across the range. And what key findings from the paper can you highlight for us?
The key findings of these studies are that adolescents at risk for insomnia can be classified into different subgroups according to their psychological profiles. These subgroups are associated with differential responses to insomnia prevention. In addition, the study demonstrated that a brief cognitive behavioral insomnia prevention program is effective in preventing insomnia disorder with additional benefits in reducing the risks of excessive daytime sleepiness and anxiety, particularly for those individuals with daytime impairments and mood symptoms.
In line with previous studies, you found that the cognitive behavioural sleep intervention predominantly led to greater improvements in anxiety than depression compared with the controls. What is your take on this? Why is it more effective with anxiety than depression?
The insignificant intervention effect on depressions may be attributed to the relatively low level of depressive severity at baseline and the modest sample size in the current study. These factors can lead to inadequate statistical power to detect significant group differences. Therefore, we cannot draw the conclusion that the intervention is more effective with anxiety than depression based on current findings. Future studies with larger sample sizes are needed to further investigate the possibility of preventing insomnia to reduce the risk of future depression.
Great, thank you for clarifying on that. Session, is there anything else in the paper that you would like to highlight?
Yes, there are some additional findings I would like to highlight. First, we found that those adolescents comorbid with mood and sleepiness symptoms represented the highest risk group of developing full-blown insomnia disorder within a 1-year follow-up period. Although we observed significant improvements of the intervention group compared to the control group in terms of insomnia severity and incidence of insomnia disorder, improvements in this high-risk subgroup were still suboptimal. This suggests that additional booster sessions or modules, especially targeting mood problems, might be needed for high-risk adolescents with more prominent sleep and mood symptoms. Second, we found that daytime sleepiness is a notable feature for subgrouping at-risk adolescents and a key factor associated with intervention responses. This finding has not been thoroughly reported in previous studies.
What are the implications of your findings for CAM professionals?
Our findings indicate that a brief cognitive behavioral insomnia prevention program is effective in preventing insomnia disorders with additional benefits in reducing the risk of daytime sleepiness and anxiety, particularly for those with daytime impairments and mood symptoms. Therefore, future development of insomnia prevention programs should consider these specific insomnia phenotypes with a view of develop personalized care for different subgroups.
Your findings demonstrate then that timely intervention is effective in preventing insomnia disorder and reducing symptoms. How do you envisage your findings being translated into practice?
I think there are several steps that can be taken to translate our findings into practice. Firstly, it is crucial to integrate cognitive behavioral insomnia prevention programs into routine mental health care for adolescents, as this program has been demonstrated to be effective by our study. Therefore, efforts should be made to ensure that insomnia prevention programs is available and accessible to adolescents, particularly in primary care and the broader community. Secondly, healthcare providers and practitioners should be aware of the presence of subgroups among at-risk adolescents that might respond differently to insomnia prevention. This finding may guide clinical judgment and help develop personalized prevention. For example, adolescents with prominent mood and sleepiness symptoms may benefit from additional treatment components, especially targeting mood symptoms. Furthermore, in order to facilitate the implementation of evidence-based insomnia prevention programs in mental health care settings, further adaptation of our current programs may be needed to move forward to a step care framework.
That's very good. Thank you. Are you planning any follow-up research, or is there anything else in the pipeline that you would like to share with us?
Actually, we have conducted a 3-year follow-up, and the manuscript is currently in preparation. In this follow-up study, we found that the beneficial effects of the insomnia prevention program did not sustain over the 3-year follow-up period. The implications of this finding aligns with the current study, suggesting that booster sessions during the follow-up period may be necessary to maintain the long-term preventive effects. In addition, we have plans to further our research on the identification of different subtypes of sleep and circadian problems in adolescents. Furthermore, we plan to investigate the possibility of preventing sleep problems through the adoption of transdiagnostic sleep and circadian intervention with personalized components to reduce future psychopathologies.
Fantastic. So lots in the pipeline.
Yeah.
Finally, Suchin, what is your take-home message for our listeners?
The take-home messages would be that based on our findings, adolescents at risk for insomnia can be classified into different subgroups according to their psychological profiles, which are associated with differential responses to insomnia prevention. A brief cognitive behavioral insomnia prevention program is more effective in preventing insomnia and reducing the risk of daytime sleepiness and anxiety among adolescents with a higher level of daytime sleepiness, anxiety, and depressive symptoms. So these findings suggest the need for further phenotyping at-risk adolescents to develop personalized intervention.
Great. Wonderful. Thank you so much. For more details on Dr. Suchin Chan, please visit the ACAM website, www.acam.org, and Twitter @ACAM. ACAM is spelled ACAMH. And don't forget to follow us on your preferred streaming platform. Let us know if you enjoyed the podcast with a rating or review, and do share with friends and colleagues.